Okay. Good morning. All right, we are live. Good morning, everyone. It's a rainy Saturday, so hopefully you guys have some plans to get things done around the house today. Today we are going to talk about safe voting in a pandemic, and then I'm going to go over some of the key points on the Initiative 65 vote. So first, just a general update on COVID. We are starting to see cases increase here in the state and then across the nation as a whole. I think I saw a headline this morning that in general today, I believe, has been the highest number of cases reported in a single day throughout the country. So that's just one thing to keep in mind, to continue to keep your guard up, do the things that we recommend: masking, keeping your distance, and washing your hands. Even if your state or local government doesn't have a mask mandate in place, just remember to do that and be aware of the people that you are spending time around, especially if they have high risk conditions and things like that. So don't let your guard down. COVID definitely is not going to do that. It's going to be here for a while. So we just need to stay on our toes and keep doing those things we know are helpful in preventing its transmission. And then my plug for a flu shot, it's definitely flu season. So make sure, if you have not gotten that already, make sure that you get your flu shot soon in the next couple of weeks. So, as usual, feel free to put comments in the bottom over here in the comment section, and I will do my best to answer those questions as they come in. I do have on my new Mona Lisa mask shirt, so just so you guys can see what that is. I think this is a fun shirt to wear. It's exciting. So anyway, we will start with voting safely during a pandemic. So some of the key things here are going to be, what you're doing when you have any other kind of typical outing. So making sure that you wear your mask, use your hand sanitizer, and try to keep your distance. If you're waiting in line at the polls to vote, there should be, things in place to kind of provide that adequate distance. So just make sure that you're trying to observe that. If you're waiting in line, try to avoid chit-chatting with people too often. Hopefully the weather will be nice, and there's going to be plenty of space to wait outside so that things are well ventilated. So keep an eye on that, especially if you're just having to wait. One thing, hopefully, to maybe reduce waiting is that you can go early, or maybe try to go at those times that are not peak times. So lunchtime will probably be a popular time, right after work. So maybe really early in the morning, mid-morning, or mid-afternoon, if you're one of those people that is not on a set work schedule and you can make those adjustments and changes. That's a good way to hopefully make sure that you don't have to wait in line too long. As far as just other sanitary measures, make sure maybe try to take a hand sanitizer with you in your pocket, or some sanitizing wipes. So as soon as you're finished using whatever means you're voting by or on, you can sanitize quickly and easily. Make sure that you sanitize your hands before you remove your mask once you kind of get back in the car or exit the building. You definitely, to kind of increase that, you could consider wearing gloves, consider wearing glasses or a face shield in addition to your mask, and that kind of thing. And that can just, be other further measures to help cut down on any potential exposure or transmission. Another thing that can be really helpful is looking at a sample ballot ahead of time so that you know exactly who you're voting for. That can give you an opportunity to do a little bit of research on the things that are on the ballot or the candidates that you're maybe unsure about. So that's one thing that can be really helpful to do, is take a look at the sample ballot for your area. If you are here in Oktibbeha County, which I think most of you guys are, you can go to the Oktibbeha County website and you can find a sample ballot that is divided up by your precinct. So I'll post the link to that in the comment section once we're finished here with the live video part, and you can go there and take a look at the sample ballot for your area. I'm sure if you're in another area, then your city or county should have something similar on their website. So that can be helpful, just to kind of have a plan and know how you're going to approach things so that you can spend the least amount of time possible inside the building or your polling center, wherever you're going to vote. So that is, I think, everything I have on my list for just going to the polls and voting safely. The next topic that I wanted to cover is probably a little bit controversial, and I put this on my page already, just with the caveat that, in general, I really don't like to talk politics, because I think everybody has their, own opinion and reasons for that, and I just want to be a good source of education and good information. And so I'm not ever going to get too political about anything, but this particular topic, the Initiative 65, that covers the approval of medical marijuana in the state of Mississippi, is one that is really important and pertinent to kind of what my goals are in educating you guys, because it's something that can affect your health, potentially your children's health, and various things just for us as a state in general. So I think it's really important to understand some of the specifics of this and why our majority physician organizations and a lot of other organizations are opposed to the current Initiative 65 amendment to the Constitution as it currently stands. So just a little bit of information about that in general. The current Initiative 65, as it's proposed, is going to be an amendment to the Constitution specifically. So basically what that would mean is everything that's outlined in that as an amendment to the Constitution would stand, and there's not really any room for legislative action to create more specific laws or kind of regulations that can be tailored to our state and our communities as a whole. And so that's one important thing to kind of recognize. From a medical standpoint, it's kind of a tricky situation, as I think a lot of you are beginning to learn and realize how some of things from the research standpoint and approval of medications and treatments works. As we've been in this COVID era so far, things do not move quickly in the world of trying to get things approved and research the true benefits and potential harms of a specific treatment regimen, whether it be a medication or behavioral therapies and that kind of thing that we make recommendations on. It takes a long time and a lot of participation in different studies to really understand and know what the true benefits of a treatment are, and then examine what the potential harms or side effects may be. So in the instance of medical marijuana specifically, there are definitely certain conditions that we have seen so far that there's a high likelihood that medical marijuana can be beneficial for certain conditions. Probably the most common ones that you would see or hear about are things like seizure disorders, or specifically cancer patients that are terminally ill and have a lot of side effects from either their chemo or a lot of chronic pain problems. So those are the two populations that we've probably seen the most information on so far. But even in those specific areas, we just don't have enough evidence to really say, this specific treatment with medical marijuana is more beneficial than some of these other drugs or medications that we can use. In some of those situations, we don't necessarily know what the harms may be. And so that's the biggest thing from a physician standpoint when we're looking at determining what conditions this could be beneficial for, what patients it may or may not be appropriate for as far as the benefits and the potential harms are concerned. We just don't have enough information that is compiled in a scientific manner to really give us enough to say, yes, this would be recommended for this subset of patients, and no, it would not be recommended for this subset of patients. So that's one big underlying issue, is that there's just not enough evidence and data to really tell us specifically, how much would be appropriate for this particular patient, or what patient should we really avoid it in. One thing that you'll hear me talk about in my video that I did last week that touches on nicotine and some drug use in younger patients, especially the teen population, is that the brain takes or can develop and continue developing up to age 25. And so there are a lot of things to suggest that certain products like marijuana and other drugs, even nicotine, can have really negative effects on the developing mind and brain. And so that's something that there still needs to be a lot of research done on as well. And so that's one thing to take into consideration with this too. We definitely don't want to do harm, especially to a younger population of patients who are still in that developmental phase. So those are kind of from the true medical standpoint, things that we're taking into consideration, and why when you talk to the majority of physicians, that's going to kind of be one of the main points that we're saying, we need to hold off on this. We need a little bit more information. From a practicality standpoint, with what Initiative 65 kind of outlines in how this would be implemented here in Mississippi, it puts all of the regulation and implementation and everything that kind of pertains to this as an industry in the hands of the Mississippi State Health Department. The health department is a great organization that has a lot of duties and a lot of different things that probably many of us, even me, don't realize they are responsible for. The health department is basically our state's organization that helps with a ton of public health initiatives. So things that have to do with child and adult health and well-being. As we've learned in the coronavirus pandemic, they're responsible for things that have to do with communicable diseases. In the last few years, they have been subject to some budget cuts and things like that. So our organization, especially here in Mississippi, already has a lot on their plate, and they're, in some cases stretched a little bit thin. Certainly right now, they're very busy with things as far as it relates to coronavirus and trying to keep all the citizens of our state safe as far as that's concerned. So this would be a huge burden on the health department to manage that and kind of find all of the ins and outs with growing and dispensing and all of that kind of thing. So that's one thing that is a big flaw for our state specifically in this, that Initiative 65 puts out as part of the stipulation that would be the amendment in the Constitution, that I think that's just not the right way to go about it for us, because that would be a very big burden on our public health system. The other thing as it relates to that, kind of specifically, all of the revenue and the money generated from it all has to funnel back into programs that goes with medical marijuana. So a lot of things like this you'll see in kind of other states or similar industries. Some people think about, the tobacco industry, sometimes the casino industry can be used as an example, that they have a lot of taxes or things like that feed back into programs for the state that can be beneficial for other purposes like education or public health in general. As it stands with this amendment to the Constitution, none of those things would be possible. So it would all feed back into the marijuana aspect of things specifically, and not really have any means of potentially benefiting any other programs within the state. So those are kind of the highlights of the specifics on Initiative 65. I know a lot of this stuff is really kind of confusing. Just to touch on Initiative 65A, that one, in the event that, either of these kind of gets adopted on the ballot, which I'll show you guys in just a minute, 65A allows things to go through the legislative process as opposed to being an amendment to the Constitution specifically. So when it goes through that process, we have the ability, ideally, that the medical community can coordinate with legislators and really find the right way to implement something like this in our state. We can have discussions and, more appropriately make laws and regulations and things like that are going to be beneficial and protective to the citizens of our state as a whole. So when you look at your sample ballot, it should look something like this. I've posted this picture already. So this is my demonstration. I got new markers for you guys so that you can see everything in new colors. So in general, let's see if I can get this where you guys can see it. So you want to vote against both Initiative 65 and 65A. So that's going to be the first question on the ballot. And then you want to vote for 65A on the second portion of the question. So I'll make sure that you guys can see the sample ballot in another post that I'll do over the next few days. But this right here, I think you can see for the most part. I'm kind of backwards on the camera. But you can see that's what your ballot should look like. And you want to go against both, like I said. And then on your second vote, it gives you the option for 65 or for 65A. And so you want to select that 65A option. And that's kind of a safeguard to make sure that the proper channels are used in the event that it does pass. So against both, and then for 65A. And again, I'll post some additional information over the next week or so, just with some more tidbits of facts and things like that, and then some other pictures that hopefully you can see a little bit more clearly of the sample ballot. And again, I will post that the link to the Oktibbeha County website that gives you a list of the sample ballot for your specific voting precinct, and it will have that on there as well. One question that I got when I was kind of asking or polling for other questions was about the need to still wipe down things like your groceries or chairs and things like that when you're kind of doing general outings. I think right now, from what we've learned, I'm not wiping down my groceries and things like that anymore, or packages that I get. In general, we've not seen that transmission seems to be a big problem in products and things like that. So you definitely, if you're going to the grocery store or if you're handling all that stuff, you definitely want to hand sanitize regularly, before you go into the store, after you leave the store, or once you've kind of unloaded everything. You want to make sure that you hand sanitize so that you're not, touching your face or your eyes with, anything that you could have picked up. But in general, I think that has been a much less prevalent means of transmission. If you are going to church or you're going somewhere and you're going to be sitting kind of in a public area or in a chair, it's definitely not a bad idea to wipe that kind of thing down if you're able to, or use your hand sanitizer on certain spots. Some of that, you never know if somebody could have, brushed their nose or coughed in their hand or something like that and touched that surface. So those kind of things you may want to do, because you just don't know the length of time that somebody may have been there before you. So in general, that kind of thing can be good to sanitize, especially like if you're going to a restaurant or something like that. I think most of them are pretty good about doing good sanitary measures between guests, but that's kind of my general approach to that. So definitely, if you guys have questions about that kind of thing, feel free to message those to me or send me a comment somewhere, and I'll do my best to answer those either in the comments or with my next video. If you think about that kind of thing during the week, or if you have an idea for a video, then let me know that as well. Again, the goal is just to be educational and helpful for you guys, so I hope that this has been a good resource for you. So that's all I have. So I hope that was helpful. Again, just let me know if you have any questions, and I'll do my best to answer those. And I hope y'all all have a good weekend. And I'll see you next week.